Hello and welcome to the Safe Patient Handling and Mobility Emergency Preparedness education today. I am Amber Perez. I am the clinical director for YACE Medical, but I am also a nurse and was previously a safe patient handling coordinator. I prepared this for some of you. I've talked to a lot of my customers, and a lot of you are safe patient handling coordinators, and you have been sent home during this time. And I know you feel a little bit helpless on what you can do. And then many of you are in the hospital still, and many of you are being pulled away from your normal duties to assist during this time. So I put this together for those of you who have the time or maybe are seeking out the information on how you can help and how you can create this preparedness plan. And I'm sure, like many of you, until something like this happened, you maybe didn't have a safe patient handling preparedness plan, and it's really gotten all of us thinking about that. So this is really on how to prepare and respond in emergency situations. And of course, this one is about what we're dealing with right now with COVID-19 and a pandemic virus. So I'm going to go ahead and get started. So we're looking at our current situation here. I know many of you have reported that your safe patient handling and mobility committees and your activities are paused, understandably. BMAT rollouts, early mobility rollouts, or planning has been paused. Safe patient handling coordinators are assigned to other duties or sent home. Hospital is an emergency management protocol, and your standard education sessions, orientation, conferences, training, and implementation are all paused. So I think we're all kind of in the same boat, and that's what everyone is facing right now. So I want you to consider some things that you've probably already started to think about. So as things start to get worse and change, and we start to see the fruition of what's happening right now, we know that there's going to be fatigued workers. There will be a heavier than normal workload and a lot of mental stress. And we know that that increases the risk for patient handling injury. And like many of you, I am also concerned when this happened, not only about the effects to everyone around us and ourselves, but what will be the impact long-term to our healthcare workers and caregivers who are already at risk for injury. We know that right now the focus is on the current precautions. Infection prevention will be prioritized over safe patient handling and mobility, and we understand why it has to be. We also know there's going to be a surge in patient census that may deplete normal PAR levels. Protocols and operations may change as well. I think we can all anticipate a heavier BMAT level 1 or dependent patient population. And then for some of you, your census may exceed current bed capacity. So I think the overall theme of this is plan, don't panic. We know that safe patient handling and mobility still matters, and you still want it to matter, because as our caregivers are out there protecting everyone, we want to protect them. That's our role, right? So the first thing that we really need to do is assess your current situation. Think about what is your backup plan, and then finally, how can you offer support? So safe patient handling and mobility does still matter. We know there will be high risk situations. We anticipate an increase in those. We know that safe patient handling and mobility reduces the risk of patient handling injuries. We all know this, but we also know safe patient handling and mobility offers efficiency. So I want you to think about it in those terms sometimes when you're having conversations in the next few weeks. Less caregivers are needed to perform movement and mobility tasks. For example, we can use a non-powered stand aid with one person, where that task of standing and transferring or moving that patient may have taken 2 people. So when we have less people, let's think SPHM. Let's think of these tools as an additional set of hands in some of these circumstances. We know that patients still need to be turned, boosted, proned, transferred, and mobilized. So there's still a role for this equipment and for these practices. And we also know that evidence-based research indicates that we see positive patient outcomes related to respiratory illnesses with early mobility. It will be important to not only do respiratory turns, so we need to turn lung over lung, but we also need to get these patients up eventually, the ones that are recovering. And we need it to be done safely and efficiently in order to make this still happen. So I want to go over some of the products that you have in the hospital and really discuss and define them. I know some of you are newer, or maybe you're in a new facility and you're not really sure what you have in your facility. Maybe you've been in your facility a long time and infection prevention hasn't been a focus. So we're going to go over what is washable, wipeable, semi-wipeable, which some of you may not have heard of, disposable, talk about lift equipment cleaning, and sterile covers that are available. So when we talk about washable, right now the CDC states that according to the current threat of COVID-19, it transmits via droplet transmission. And so far, there is no evidence to show that it lives on fabric and material once we've laundered it. So we know that we need to launder the material just like you normally would. You follow your sling manufacturer's recommendations for washing and drying your slings as normal. So as far as I know, and as far as the CDC recommendations, there's no reason that you cannot continue to use your washable sling process as long as you're following your sling manufacturer recommendation for washing and drying and disinfecting. But remember, one sling per patient. At this time, especially with patients on precautions, we should not be using washable slings or any slings between patients. And this is something we want to be very vigilant of during this time, and remind your caregivers of this as well. Wipeable. So when we talk about a truly wipeable sling or device, it should be made of some sort of wipeable polymer. That's like a plastic or a rubber type material. All parts of the sling, buckle, attachments should be made of a material that can be wiped with a cavi wipe, Sani wipe, bleach wipe, whatever your hospital protocol is. So this is like you're seeing in this picture to the left. One of the things you might want to look for is what's called welded seams. So they don't have a sewn seam. There isn't that thread and that material, which can cause two things. That the material itself is like a fabric type material, and we're not always sure that that can be disinfected properly with wiping. But also the welded seam completely seals the outside from the inside. So if there's a foam or something on the inside of that material, that heat welded seam is keeping that material completely sealed up. So ask your manufacturer for documentation, verifying that the sling is fully wipeable if they're claiming it's wipeable, and that your cleaning solutions are safe to use on the sling without degrading the strength or safety of the sling. That's important as well. Look at what your sling manufacturer's cleaning guidelines are, and then call and verify if you're not sure. You want to make sure that when you're using those harsh chemical cleaners over the welded seams where the loop attachments are, the buckle attachments are, that's not going to weaken that area, because then that would create a risk. So just double check, make sure that it's safe, and make sure that everything is cleared through the sling manufacturer. And then just think about, if there is fabric on the sling, it may not be fully wipeable. If there is a fabric that's out there, I'm not the expert on fabric, so there could be a completely wipeable fabric. I'm not aware of it, but I'm not going to say there's not. So I would say reach out again to the sling manufacturer for documentation and evidence that that is a completely wipeable product. Now, these wipeable products should be able to be wiped down completely and cleaned and used between patients. But again, let's be cautious here. Get your infection preventionist to clear everything before you make these recommendations. Semi-wipeable. Now, you're going to see a lot of these out there. This is something that really isn't truly fully wipeable. Semi-wipeable are these nylon type materials like reusable slide sheets. Sometimes you'll see that slide sheet type material in a sling. You'll see these gait belts and sit to stand and walking belts that have a more wipeable nylon type surface, but there is fabric on the sling, and it is probably not truly fully wipeable. So the intention really is you could wipe them between uses on the same patient, for example, because you're just using it with that same patient and perhaps something spilled, or you're just keeping it clean between uses. That's really the intention with these semi-wipeable products. Some subacute long-term care facilities, when they're not working with patients that are on contact precautions, are okay using these between patients, as long, again, as they are not being used with patients that have contact precautions. When we're talking about patients that have any risk for infection, transmittable infection, viruses, and they're on contact or droplet or airborne precautions, we should not be using these between patients. So please be very aware that you understand the difference between wipeable and semi-wipeable in your facility. Disposable. These should be labeled as disposable or single patient use, and they're intended to be used on just that one patient. Now, single patient use does not mean single use. You can use these on the same patient until their lifetime is used up, or they have become heavily soiled, or there's another reason to dispose of it. But again, just on one patient. They should never be laundered. Most of these have a label that if it's laundered, the label exposes and says do not use, or it says do not wash on it. But you want to make sure that your laundry vendor, if you have a laundry vendor and disposable slings, understands not to put these back in circulation if they have come into the laundry bins, to see these, identify them, and dispose of them. Air-assisted lateral transfer devices can be disposable, as seen here. Slide sheets can be disposable, as seen here, and then a variety of slings and repositioning sheets are also available in disposable options. Now we're going to talk about lift equipment cleaning and disinfecting. So mobile equipment should be completely wiped down after use in a contact precaution patient's room. So the most important thing is to follow your infection prevention recommendations at your facility for the approved cleaning practices. I'm sure they're talking a lot about that right now. We want to clean all the surfaces of the lift and then leave the sling in the room with the patient after each use. Read the disinfecting wipes instructions. Oftentimes it says you must completely wet the surface. It must remain wet for 2 minutes. Sometimes there are different instructions. If your facility uses UV disinfecting, or I've seen these fog disinfecting where you put it in a room and it does it that way, just make sure you know what your facility's cleaning process is, and that your super users, unit peer leaders, or champions understand how to fully clean the lift, and that they should be fully cleaning any lift that is going into a contact precaution patient room after it comes out. We want to make sure that we do everything we can not to spread anything. And there is evidence, according to the CDC, that COVID-19 does live on hard surfaces. So let's be very, very vigilant to properly clean according to the recommendations of your infection preventionist. If you're not sure, ask your infection prevention professionals. I'm sure there's a resource page on your intranet at this time. Lift equipment cleaning on ceiling mounted patient lifts. Now, the good thing about this is that they are often in a room with the patient. You're not moving them to room, although some of them can be moved. So if they can be moved, you want to consider it more like a mobile lift with the cleaning practices. If it's in the room and it's staying in the room, we want to make sure that when that patient discharges and they're doing that terminal clean, that the sling bar, hand control, the strap and the emergency lowering pull and any cords are completely cleaned after the patient discharges from the room. Consult with your lift manufacturer for proper cleaning and disinfecting procedures, and then ask about any fabric or nylon materials, and then make sure you're always cleaning the hard surfaces as described before. Some of these ceiling lifts have all wipeable straps and emergency straps, and some still have the nylon. So just ask your manufacturer, what is the recommended way to clean this, and then consult with your own infection prevention protocols and make sure that that is in alignment. Just because your your lift manufacturer says that it is safe to do one thing, you want to make sure internally that that is in alignment with your infection prevention practices, because the lift manufacturer has to think about the integrity of the strap and the integrity of the materials and what those chemicals can do to those materials. You need to think about protecting that patient from the transmission of infection. So make sure those protocols are in alignment with each other. And then always leave the sling in the room with the patient. Like we talked about, whether it's disposable or washable, once you use that sling with the patient, leave it with that patient. There's no reason to bring it out of the room until that patient is done using it. Air-assisted lateral transfer devices. So if it's reusable and used with an infection precaution patient, I recommend, and they recommend, the manufacturers, that you launder this between patient use. Not everybody realizes you can launder them. Most of them can be laundered. Now, there are different types in the air-assisted lateral transfer when you look at the heated drying process. So what I know is, at least with one company, there are 2 different types. With another company, I'm not so sure. So reach out to your own manufacturer and say, can we make sure that we have the updated laundering process? Either way, the laundering process needs to ensure that it is completely disinfecting the product and that it is safe to use. And your manufacturers can help you with that. But just make sure you know whether or not you can use heated drying or it should be air dried, and make sure that you are washing these between patients, not just wiping them down, especially when you have somebody with contact or droplet or airborne precautions. Finally, there are sterile lift covers. So this is a mobile dependent sterile lift cover, and it's available for the use in the OR or for infection prevention. So the covers are, think about it like personal protective equipment for the lift almost. When we don our gown and gloves and mask, it's similar. We're covering the lift, so we're keeping the lift clean and we're keeping anything that could be on the lift from coming off onto the patient. And the covers are compatible with most dependent mobile lifts, and it's like a protective covering. So this might be an option to consider if you have lifts that are going in and out of these rooms. So next, you want to assess your current situation. Whether you have washable or disposable slings, you need to ask yourself, what is my backup plan? And then how can you help? Because I know many of you feel a little bit helpless in the situation and maybe want to know what you can do. So we'll start with washable slings. Let's think about, what is your backup plan for slings shortage? So have you discussed with your laundry vendor what you're going to do if there is a shortage of slings? I think it's wise at this time right now, well, many of you are still early in this pandemic process, to reach out to those laundry vendors and say, listen, it might be that we need a faster turnaround. We might have a greater quantity of slings coming out. Can you get them back to us sooner? Oftentimes your slings come back, Tuesday, Thursday, Saturday, something like that. That may not be enough. If it's possible for your sling vendor to increase their laundry supply process where they can turn them around faster, that might be a great backup plan. But I think it's best to have the conversation now. Don't wait till all of a sudden you go, oh my gosh, we're out of slings on the shelf. What are we going to do? Maybe your laundry vendor says, yes, perhaps, but we're going to have an overload on everything. We're going to have the sheets and the pillowcases and the gowns, and we can't really do that and guarantee that we can prioritize getting that back in time. So then, do you have a backup supply? Perhaps you would consider disposable slings as a backup in case you need more, just because they're lower cost and you may not need that permanent increase in washable sling supply. Or you may need more washable slings right now, and it's good timing to be placing that order and getting those on the shelf just because you may be using them right now. And then I've heard from several customers that even though you have a washable process, that they're considering a disposable process just for those contact precaution rooms, just to be extra careful and to ensure that there is no cross-contamination. So have you had these conversations, and do you have a plan? This might be something you discuss with your logistics or your supply chain, and is it something that you can make that recommendation right now? Also consider low-tech solutions. So we know good, better, best, right? Using a ceiling mounted lift and a repositioning sling, absolutely a great practice. Using your air assisted lateral transfers when you have air supplies, great practice for making sure that nobody is getting injured. But what is your backup plan for when you have an increase in census and you've exceeded the beds? Or if you're setting up temporary areas, do you have slide sheets? Do you have low-tech solutions? I know many hospitals, you know, have completely covered their hospital with ceiling lifts and they don't feel there's a need for this low tech, but there might be a need to have something available just to provide at least a level of safety and reduced risk of injury, even when it gets busy and there's a lot of people and maybe not so much help and not so many people to be helping boost or turn or do some of these activities. So just something to consider as a backup plan. So disposable slings. Have you discussed your anticipated need for disposable slings? So right now, your logistics and supply chain probably have a regular ordering process. They keep so much in stock, and you have these PAR levels. So just consider increasing your PAR level. Talk to your supply chain and just say, do we have enough if we had a sudden increase? And it may not be in everything. Like I discussed earlier, if we're anticipating an increased census of these BMAT level 1 or dependent patients, you may not need to increase your supply of sit to stand slings or walking slings, but those repositioning slings perhaps, or the seated slings might be something you want to consider increasing the PAR level on. You may not need to increase the PAR level if you just have the conversation with supply chain and say, what is our turnaround time? Do we order from a vendor that has a local distribution? If so, perhaps they don't need to order extra supply, but they need to reach out and say, hey, do you, my distributor, have enough supply if we were to increase our order in the next coming week? So really just giving everyone a heads up and having a plan in place. Or reaching out to your manufacturer. Now, perhaps you reach out to your distributor or you manufacturer and they say, we've gotten a huge increase in orders. Maybe you want to consider having a backup vendor. And it might not be something you want to have to decide on the fly. So it's something to think about. If our regular vendor is unable to supply us, who would we use? Which sling do we find acceptable? And maybe I have that in my own personal plan. It's not something that I have to make big decisions about in the future, but I might find that there's a sling that seems most comparable to the one that my staff are used to using, has the same number of straps, attaches the same way, so that we don't have to worry about human error, but we do have a plan in case your distributor or your manufacturer tells you, hey, I'm not so sure if I can fulfill all these orders if they start to increase. One of the big questions people are asking is, how can I right now? I kind of feel helpless. Maybe you're an ergonomist or you're a risk manager or safety, and you are being pulled and asked to do other things, but there's not a lot you're doing focused on safe patient handling. So number one, ensure sling availability by planning now, like we talked about. Make sure you have a plan before it becomes a problem. I suggest if you are still in the facility, if you haven't been sent home, take over some of your UPL super user champion duties. Maybe rounding, ensuring the lifts are plugged in, the batteries are working, the slings are on the shelf. All of these regular things, the BMAT is being performed, questions are being answered, things that you can do to just be a helping hand. Also reminding staff to use the lifts for efficiency. This might be a good time to remind them, hey, if we are short-staffed, remember Q2 hour turns can happen with one person and a repositioning sheet and a lift, or a transfer can happen with a non-powered stand aid and one person. So just reminding them, quick huddles, this equipment's here for you. And then offering those low-tech solutions when you have that expanded bed capacity. If you're having hallway beds, if you're setting up temporary areas, do you have slide sheets? Do you have low-tech solutions? If you have air-assisted, do you have extra air supplies? Do you have disposable air-assisted mats? Just things that you can think ahead of that will really help reduce that risk of injury for our caregivers. Also, offering ICU and inpatient unit education about using SPHM devices for early mobility. Now, obviously, you're not going to be able to hold an entire education session right now or put out any extensive information, but just reminders. If you're rounding, if you're on the unit, maybe you need to make a flyer or a reminder piece that you can send out via email, reminding staff, because oftentimes we find that hospitals don't know what capacity their equipment has. They don't realize you can put a walking sling on a lift, or that the foot plate is removable on a non-powered stand aid. And if we're moving towards making sure that these respiratory patients are getting up and moving toward their recovery, just quick reminders, flyers, information sheets that these devices can help. Also, respiratory specific techniques. I was just speaking to a fellow consultant, and he works for one of our favorite air assisted lateral transfer device companies. He's going to be hosting a webinar teaching how to prone a patient using that device. We will actually post his webinar on the Sustainable website as a resource, because we want to share all the information we can. But reach out to your vendors. I mean, that's a big one that we get a lot of questions on. How do we prone these patients? If they have acute respiratory distress syndrome, that is one of the first interventions, is turning that patient onto their stomach. And we want to make sure that we offer solutions that are safe, because when people get rushed and there's panic, they let go of safe patient handling. And then finally, offer to help your infection prevention colleagues in their time of need. Remember, they could be instrumental in helping you later. You know, this is their crisis time. They are also in an ancillary department working on a focused effort, and right now they have a tremendous amount of stress. If we need to offer with infection prevention, education, rounding, support, you know, we're all in this together, and we want to let them know that we're here to support them. So I think that's one of the best things you can do, is take your safe patient handling hat to the side for a second and make sure that we're offering to help everybody where we need to. And I know many of you are, I've already heard that. And then we just want to let you know we're here to help. All of us at Sustainable, we are all consultants with a passion for safe patient handling. We're going to be posting this and other resources that we're creating while we're working from home on our website, www.sph-solutions.com. We're also happy to find answers for you. If you get a question about if you can do something in this situation, how to do something in this situation, please email us. I'm not saying we have all the answers, but we know lots of people out there, lots of experts. We will field your questions and say, does anybody have an answer to this situation? Has anyone run into this? What are the best practices at this time? Email us, consultants@sphsolutions.com. We are also available to offer virtual training to help support your efforts. If you have a training session that you are still holding, I know I have a couple customers who are opening new units right now. Whether or not it's our equipment, we're here to help you. Please let me know if you need a virtual training session, if you want us to be where we are offering instruction, guidance, support, whatever we can do, we want to help you. Also, we can help create education pieces, checklists, posters, information, anything that you need. If you want to put out some information and you don't have your support of your marketing people right now, please reach out. We want to do what we can to help you. Whether you're a customer or not, please remember, Sustainable, we're part of your community. SPHM is one of my favorite medical communities because we all come together, and this isn't about products and selling. We want to do what we can to help in this situation. So please let us know if you have any questions. Is there any information that you need, extra education you want us to create? We are here for you. Good luck and stay safe, my friends.